So now let's talk about the male internal and external genital organs. So to start off with, let's just talk about the descent of the testes into the scrotum. So initially in uterine life, the testes are found higher up in the what? In the abdominal region. Now, due to the lengthening of the fetus, we see, and also due to the connection with this gubernaculum, which is just a connecting stalk which connects the tip of the testes to the scrotum, okay, to the developing scrotum. We see that as the baby lengthens, the scrotum is just pulled into the what? Into the scrotum. And also due to the processus vaginalis, which is just a diverticulum or an inward bulging, okay, or defect in the anterior abdominal wall, we see that it also helps in the descent of the what? The testes. Okay. So this processus vaginalis, it later becomes obliterated to form what is called what? The tunica vaginalis. Okay. So the descent of the testes into the scrotum is mainly because the testes are responsible for sperm production, and sperm production cannot occur in the what? Inside the body. So the body has developed a pouch outside of the body that can help facilitate this optimum temperature, which is about 1 to 2 degrees below body temperature. Done. Okay. Now, as the testes descend into the scrotum, we see that it takes fibers. Okay, it takes fibers of the transversalis fascia. Okay, it takes fibers from the internal oblique, then it takes the aponeurosis of the external oblique. Okay, so these are then okay, let's first start with the coverings. So the coverings of the spermatic cord include, we say that it takes the fibers of the external oblique aponeurosis from external going internal. The external oblique aponeurosis becomes the external spermatic fascia. Then the internal oblique aponeurosis becomes the cremasteric fascia. Then the transversalis fascia becomes the internal spermatic fascia. Then the processus vaginalis becomes the tunica vaginalis. It has a visceral layer and a parietal layer, and also a cavity. The visceral layer is in communication with the testes, and the visceral layer and the parietal layer they communicate with each other via the what? The cavity of the tunica vaginalis. So the tunica vaginalis is found anteriorly, okay, laterally, and medially, laterally, but posteriorly it is deficient. We'll talk about it later. Then the spermatic cord has contents. Okay, it is like, let's see where it's written. There's the testicular artery and vein. The testicular vein is also called the pumpiform plexus. It helps in heat exchange, heat countercurrent exchange, okay, so as to moderate the temperature in the what? In the testes. Right, it is the vas deferency, the artery to the vas deferency, and it also has the genital branch of the genitofemoral nerve. Okay, it also has the artery to the cremasteric fascia and muscle. Okay, so yeah, those are the contents And also we see that we have autonomic nerves, they are not present here, and testicular lymphatic vessels, which are not present on this schematic diagram. So done. That was the spermatic cord. Now the scrotum. The scrotum, we say that it's an outpouching. It's a continuation of the anterior abdominal wall. Okay, it contains the lower fibers of the spermatic cord. The spermatic cord starts at the level of the deep inguinal ring. Okay, so it starts at the level of the superficial inguinal ring, if I'm not mistaken. Yeah, it starts at the level of the superficial inguinal ring and extends into the scrotum. Okay, yes. So yeah, the scrotum is lower ends of the spermatic cord plus the testes, which is enclosed in the tunica vaginalis. Okay, then yeah, so the layers which we pass through as we are going from superficial to deep in the scrotum is, first of all, we remove the skin of the scrotum. Then we say that the scrotum is a continuation of the anterior abdominal wall. In the anterior abdominal wall, we had the fatty layer. In the scrotum, and the fatty layer was called the campus fascia. In the scrotum, the fatty layer, it will change its name from campus fascia to the dartos muscle. Then in the anterior abdominal wall, we have the membranous layer. In the scrotum, instead of having the membranous layer, which was called the scarpus fascia, we have the Coles fascia. Then from there, we go to the structures of the spermatic cord, which we mentioned. Okay. So another thing to note is that the cremasteric fascia, as I said, is a continuation of the internal oblique. Okay, so the cremasteric fascia and muscle are supplied by the genital branch of the genitofemoral nerve. Done. Now the testes. The testes are paired, okay, and they are separated from each other by the median rapha. It's called the median rapha. Okay, to be like something. Let me just medial or medial. Yeah, let's call it medial rapha. Like here, it separates the right testes from the left. Okay, let me see. Oh, from the left left testes. Okay, so the testes are where we have sperm production. Okay, so the testes are enclosed in the tunica vaginalis. Okay, and they are coated by a fibrous capsule, okay, which divides the site of sperm production, which is the seminiferous tubule, into these septa. Okay, the tunica albiguna, it invaginates and forms septa, which divides the seminiferous tubule into lobes. So these lobes will contain many coiled seminiferous tubule, which acts like the site of sperm production. Done. Now the epididymis. The epididymis is about okay, so before that, we say that we have the seminiferous tubule, which is the site of sperm production. So as they produce the sperm, they will channel the sperm into these straight tubules called the straight tubules, then into the reti testes, which are found in the mediastinum or the mediastinum of the testes, which then channel the testes. At this point, they are not mobile. Okay, they don't have mobility. Okay, so you see that in the seminiferous tubules they will have like a lot of fluids. These fluids will help aid in the movement or pushing of the sperm into the ductal system. Okay, then they are moved into the efferent ductule, then now into the epididymis. Epididymis, muscular tube. Okay, it's very coiled, and if we were to stretch these coils, it will reach about 6 meters in length. It's divided into a head, a body, and a tail. Okay, it acts as a storage site for sperm, and also it's the site of sperm maturation. It continues like this one as the ductus deferens. So we see that the tunica vaginalis is deficient posteriorly to allow passage of the ductus deferens. Done. Right, so yeah, the blood supply of this epididymis is from the testicular artery, which is a branch of the abdominal aorta. Then the venous drainage is from the testicular veins, also called the pampiform plexus. So then the lymphatic drainage, it follows the arteries to the para-aortic lymph nodes, okay, at the level of L1. So this pampiform plexus, you see that the right, okay, the pampiform plexus then unite to form the testicular vein, right? So the testicular vein, the left one, it will drain into the left renal vein, then the right one will drain into the inferior vena cava. Done. Now the vas deferens, okay, this one is the vas deferens or the ductus deferens. I wanted a better image. No, I don't have one. Okay. Yeah, so the vas deferens is a continuation of the tail of the epididymis. So it will exit the pelvis. Sorry, it will exit the scrotum. Okay. No, we cannot say the scrotum. It will exit the inguinal canal, right? And it will enter into the abdominal region. Then it will come back into the into the pelvic cavity by going to the posterior aspect of the blood. Okay, it will be medial to the ureters. Okay, to cross the ureter to become medial to the ureter. Then it will, you see here, it's like it's kind of smooth. It will become dilated to form this ampulla. Can you see this ampulla? Okay, this ampulla, which then unite with the seminal vesicles. Seminal vesicles are also found on the posterior aspect of the blood. They will unite. These seminal vesicles, they secrete seminal fluid, which will be rich in fructose, prostaglandins, which help in the formation of seminal fluid. They will unite, one on the right, one on the left, okay, to form the ejaculatory ducts, okay, which empty their contents into the prostate gland. Okay, so the ejaculatory duct is just the union of the ductus deferens and the seminal vesicles. Okay, so the ejaculatory ducts are the passageway of the sperm. Okay, so sperm are produced in the testes. They move via ductal system into firstly into the epididymis, then into the vas deferens. Then from vas deferens, they unite with the vas deferens unite with the seminal vesicles to form the ejaculatory duct, which empty their contents into the prostate gland. Done. Okay. So the contents of the seminal fluid they will like kind of try to be protective, to protect the sperm against the acidic environment of the what? Of the vagina. Okay. So yeah, this is just a coronal section of the blood. Okay, this one, the blood. Right. So you can see it has a base, then it has an apex. The base is projected towards the bladder. Okay, this is the bladder. This one is the bladder. Then the apex is projected towards the urogenital diaphragm. Okay, let's see it. This one, the prostate gland. It is just posterior to the what? Pubic symphysis. And it is connected to the pubic symphysis by the puboprostatic ligament. Okay. Then posteriorly, it's in its relation. We see that this is the ampulla of the what? The rectum. Okay. So yeah, the prostate has a base, apex. Okay. Then it's a gland, right? It's a gland. It is an anterior lobe, a median lobe, and a posterior lobe. Anterior lobe is just anterior to the urethra. Median lobe is between the urethra and the what? Ejaculatory duct. Then the posterior lobe is behind the urethra and below the what? The ejaculatory duct. Okay, so the anterior lobe is devoid of glands. Okay, the median lobe is rich in glands, while the posterior lobe has many glands. Okay, so these lobes, they drain their contents into the prostatic urethra via the prostatic sinuses. Okay. Then the ejaculatory duct will also drain into the prostatic urethra. Okay. Then we have a structure called the prostatic utricle. Okay, this one. Yeah, this structure is analogous to the ureters. Okay, in females, the ureters in females, and the vagina in what? The uterus, sorry, the uterus in females, and the vagina also in what? In females. This structure. Okay, it doesn't have like a specific function, but it's just analogous to that, to those structures. Okay. You see that prostate gland is a capsule, a fibrous capsule, and it is also surrounded by visceral pelvic fascia. Okay, done. Then also we see that due to this prostatic urethra, it's divided into a right and left lobe. Okay, done. And also lateral, we find the levator ani group of muscles. Done. So we say that superiorly we have, in fact, the base is resting on the bladder, the apex on the what? Urogenital diaphragm. Okay. Now blood supply is from the inferior vesical artery and the mid-rectal artery, which are branches of the internal iliac artery. Done. Venous drainage is from the prostatic venous plexus, okay, which ultimately drains into the internal iliac veins. Then lymphatic drainage will follow the vessels to the internal iliac nodes. The nerve supply is from the inferior hypogastric plexus, since it's a what? Pelvic organ. It's an organ found in the pelvic cavity. So its nerve supply is from the inferior hypogastric plexus. It's autonomic. You don't have to think to secrete things into your blood. Okay. Then in the prostatic urethra, okay, which is just the opening which drain from the bladder to the prostate, we see that we have this longitudinal ridge called the urethral crest, which divides, which separates the prostatic sinuses. Okay, yeah, it's not important for now, but just something to appreciate. We see that in the prostatic sinuses, that's where we find drainage of the prostatic glands. Their glands, they drain here to drain their contents into the prostatic urethra. So the prostate gland, it releases mucuses which lubricate the semen. Then prostatic examination, okay, we can just put glove in our index finger and palpate the posterior lobe of the prostate gland. If we put our hand in the anal canal, then the tip of our finger can touch the prostate, the posterior lobe of the prostate gland. Okay, both out the tip of the index finger can reach the ampulla of the what? The rectum. Okay, done. Now the penis. Okay, so the penis, this one. You see that the penis has a cylindrical part, this one, and the root. The cylindrical part is formed from 3 spongy muscles, okay, or erectile tissue. Then the root is formed from 3 again muscles. All right. So the base of the penis, the dorsal aspect of the penis is formed from 2 muscles. Okay, so these 2 muscles are the corpus cavernosum. They are paired. Okay, they extend to the root of the what? The penis, to form the crus of the what? The penis. Okay, then we have 1 muscle which is found on the ventral aspect, which we call the corpus spongiosum. It encloses the male urethra, which carries urine and semen. Okay, and we see that we have these glands, bulbourethral glands. They also drain their contents directly into the penile urethra. Okay, so the corpus spongiosum, it extends to the root of the bulb of the penis. Okay, so you see that the penis has this part, the expanded part here, which you call the glans penis. Okay, like this meaty part here, so the glans penis. Okay. Then here we see the urethra, the penile urethra. We see drainage of the bulbourethral glands. Okay, then we have the opening to the membranous part of the urethra, because the penile urethra is a continuation of the what? Prostatic. So it's a continuation of the membranous urethra. We'll talk about that later. Then the root of the penis, talked about it. It's like from the cylindrical part, we have extensions here. We have the crus. The crus are surrounded by muscle called the ischio cavernosus. Then the bulb, okay, it's covered by muscle called the bulbospongiosum. Spongiosus. Okay. Then blood supply. Blood supply to the penis is from the dorsal artery of the penis, which is a branch from the internal pudendal artery. The internal pudendal artery is a branch from the internal iliac artery. Make sure that you repeat that. Okay, let's just repeat. We say that the blood supply of the penis is from the dorsal artery of the penis, which is a branch from the internal pudendal artery, which is also a branch from the internal iliac artery. Then venous drainage, it corresponds with the artery. Lymphatic drainage, okay, it's to 3 sites. One of it will follow the spermatic cord to the superficial inguinal nodes. The other one will follow the vessels to the internal iliac nodes. And the last one, it will drain into the external iliac nodes. It will follow the deep inguinal. So it will follow the it just goes to the external iliac nodes. Yeah. So it is actually the glans penis, this one, which will drain into the deep inguinal and external iliac nodes. Then the rest, the skin of the remaining organ will drain into the superficial inguinal nodes. Then the erectile tissue, this one, it will drain into the internal iliac nodes. Done. Then nerve supply is from the branch of the sacral plexus. Okay. It's called the from S2, S3, S4. Okay. Call it the pudendal nerve. This one. Pudendal nerve. It will supply the penis. Done. Then the urethra. So this is the female urethra. This is the male urethra. The female urethra is short. The male urethra is long. The male urethra can be divided into 3. The prostatic part is found in the prostate gland. The membranous part, which is found in the urogenital diaphragm, okay, or the deep perineal pouch. Then the penile part, which is found in the corpus spongiosum. So prostatic part, we talked about it. That's where we find drainage of the ejaculatory duct, okay, and also we find drainage of the prostatic glands. It is the widest and the most dilatable portion of the urethra, okay. The membranous part, continuation of the prostatic part, okay. So the membranous part is found in the urogenital diaphragm. It is the shortest and the least dilatable, okay. It's the shortest and the least dilatable. Then the last one, the penile part, is the longest, okay. And then the external meters, this is the external meters. That's where we find the narrowest part, okay. Here, the narrowest part. Find the narrowest part. So you see that in the glans penis, we have, it's dilated. The penile urethra is dilated to form the fossa terminalis. And we talked about the bulbourethral glands draining their contents into the penile urethra. Yeah, so that was it.